Good evening, everybody. First of all, I would like to thank the organizing committee for giving me the opportunity to do this virtual presentation, and a special thanks for Dr. Najwa. I will talk about the executive summary recommendations from the Saudi Society of Clinical Pharmacy for the pharmacists during epidemic and pandemic. Starting with introduction. In December 2019, an alarming epidemic of unexplained etiology pneumonia occurred in Wuhan City, Hubei province in China. After that, the World Health Organization (WHO) described a novel coronavirus as a causative agent, which named coronavirus disease 2019, COVID-19. Then the outbreak started to spread worldwide, and WHO classified COVID-19 as a pandemic on the 11th of March 2020. After that, Saudi Arabia was one of the first countries to take proactive measures and actions to limit the spread of the outbreak. How? On the 27th of February, the Saudi Arabia declares that it would immediately suspend the entry of individuals wishing to conduct Umrah. After that, on the 8th of March, the Saudi Ministry of Education announced suspension of academic year and closure the schools and universities. Then, on the 20th of March, the Ministry of Interior halted domestic airlines, buses, and the taxis for 14 days. After that, it was extended duration. Then, on the 23rd of March, a curfew was imposed from 7 p.m., which was extended to start from 3 p.m. at the 26th of March. Then, on the 6th of April, curfew was extended for 24 hours. The Saudi Arabia confirmed its first case of COVID-19 on the 2nd of March 2020. Then the number of the confirmed cases nationally started to increase. Saudi officials took several proactive precautionary measures and action to limit the spread of the virus. By suspending the prayer in the mosque, including Holy Mosque in Mecca and Medina. In light of emerging outbreak, all the healthcare professionals, including pharmacists, began to function with a maximum capacity and effort. Also, the evidence shows that the skills and knowledge pharmacists have allowed them to play a significant role during the natural disaster and epidemic. So what about the Saudi Society of Clinical Pharmacy? The SSCP highly appreciate the impact pharmacists can play during this outbreak. The SSCP established an expert writing task force to summarize the proposed recommendation for the healthcare practitioner, including pharmacists, based on the available evidence. Also, we would like to seek feedback from you regarding this interim recommendation through our official communications channel, like our email, also website, and the social media. So what about the recommendation aim of this recommendation? To provide the pharmacists with insights regarding pharmacist rules and responsibilities based on the existing scientific knowledge during this outbreak. Also, which is important, the highlights and reinforces to the other healthcare providers the importance of the pharmacist participation and the role in the decision making during these circumstances. So this is the task force contain 30 recommendations. I will go through it. The first recommendation, we urge the Saudi Center of Disease Prevention and Control, CDC, and Ministry of Health, MOH, to utilize pharmacist expertise in the prevention and the treatment during this outbreak. Also, we urge all the healthcare sector to involve pharmacists in the COVID-19 emergency preparation and disaster planning during epidemic and pandemic situation. The third recommendation, we urge the pharmacist profession leaders to ensure that the pharmacy practice settings are capable of maintaining a full functionality during this outbreak. And we call on all the pharmacists to refrain from the dispensing of any medication for a treatment of COVID-19 without a valid and authenticated prescription during this outbreak. And we urge the pharmacists to continue to be extra vigilant and review the prescription before dispensing. We urge all the pharmacies and the suppliers to ensure enough supply of all medication that are used, especially for a critical and life-threatening condition during this outbreak. The sixth one, all the community pharmacists should screen any pharmacy customers and patients for the sign and symptom of COVID-19 and to provide the recommended education as per Saudi CDC guidance. They can ask them, the customer or patient, as a survey and give the recommendation based on the CDC guidance. Also, we urge all the healthcare institutions to seek the voluntary assistance of a qualified, unemployed, or retired but licensed pharmacist and technician during epidemic and pandemic situation. The pharmacist should take an active role in development and implement of institutional and national guidelines related to the COVID-19. We see a lot of the institutions develop a protocol and guideline, and the pharmacists participate on it, and some of them initiate it. The ninth recommendation, all the pharmacists should take a proactive role in educating the public regarding the infection prevention measure during this outbreak, especially in the social media. The recommendation number 10, all the pharmacists should provide the evidence-based recommendations to the patient and healthcare providers according to the MOH and Saudi CDC and institutional guidelines during this outbreak. All the pharmacists should take an active role in clarifying misconceptions and rumors to the public and direct them to reliable resources using their expertise and knowledge during this outbreak. Also, the pharmacists, some pharmacists clarify the rumors and correct it, especially in the social media, and some of them do a lectures or session for the public education. Number 12, we recommend that all the healthcare institutions implement easy to refill solution for the all outpatient to minimize potential and unnecessary exposure during this epidemic. And we saw a lot of institutions. This solution include, but not limited to, drive-through, also home delivery of the medication by either volunteers, a pharmacist or technician, or shipping delivery companies. Hello?
تفضلي دكتورة. تفضلي دكتورة.
Also, we urge all the pharmacy policy makers and directors to ensure that enough personal protective equipment are provided to all the pharmacists and the pharmacy technician at the risk of exposure during this outbreak. Recommendation number 14, the pharmacy directors should develop a guidance for staff monitoring for the sign of illness and create a mechanism for reporting for the illness and absenteeism during this outbreak by the self-reporting, also self-quarantine, and evaluation of the employee in the beginning and the end of the shift. The pharmacy director should develop a guidance and policy for employees returning to the work post-illnesses during the epidemic and pandemic situation. Also, we call upon all the pharmacy policymakers and directors to provide the licensed pharmacy technician with expanded authority, of course, under the pharmacist supervision, to relieve the pharmacist from technical duties and participate with the healthcare team for treat of COVID-19 patients. We recommend all the pharmacy policy makers and directors restrict the presence of any unnecessary staff and implement safe movement solution for the pharmacy staff during epidemic and pandemic situation. Also, we recommend modifying all the pharmacy meeting modalities and utilize electronic and virtual participation during this outbreak. For example, use Skype or apps like Zoom or other apps can use virtual lectures or virtual participation or meetings. Also, the pharmacy staff should be trained on a critical pharmacy workflow procedure, including but not limited to administrative, clinical, distribution, inventory management function during this outbreak. Also, we urge all the pharmacy policymakers and directors to implement policy to monitor the availability of the surgical mask and 95 respirator, powdered air purifying respirator, peppers, alcohol-based hand disinfectant, and gloves on this situation. Also, all the pharmacy directors and supply chain directors should implement a list of alternative vendors, especially for essential medications, medical devices, contracted services, and do the strategy to address a related shortage during this outbreak. Also, the pharmacy director should prioritize the critical and non-critical service on the basis of the essential institution-wide operations during this outbreak. The recommendation number 23, we urge all the quarantine pharmacy staff to provide technical support, for example, deliver a telehealth services to minimize the burn on duty staff during this outbreak. Also, we urge the pharmacists to continue to be extra vigilant by making sure that their patients receive a most rational and appropriate medication management, including but not limited to dose adjustment, drug therapy monitoring, adverse drug reaction, drug compatibilities, and drug interaction management, which is the major and most important role of the pharmacist. Also, the pharmacist should collaborate with the healthcare team, including physicians and nurses, to minimize unnecessary contact between the caregivers and potentially COVID-19 infected. By adopt the cluster care principle, by switch the patient from short-acting medication to long-acting medication. For example, if the COVID-19 patient is diabetic patient, so give the medication once daily instead of 2 or 3 times daily, and switch medication from the short-acting to sustained release. Also, bundling the medication administration time during epidemic and pandemic situation to decrease decrease and minimize unnecessary contact between the caregivers and the medical field with the COVID-19 patient. But put on your account drug-drug interaction and drug-food interaction as a rule of the pharmacist. Also, we urge the pharmacist to maintain and record their intervention during the outbreak. Recommendation number 27, we urge the pharmacy professional leaders to create a channel of communication that function effectively during this outbreak. And also we urge all the healthcare institutions to share their experience and report it to the Ministry of Health during outbreak. Recommendation number 29, we urge all the pharmacists to refer. We urge all the pharmacists to refer to the most updated version of the COVID-19 guidelines, including a proposed treatment protocol issued by the Saudi CDC and Ministry of Health. And this is the updated version of the Saudi MOH protocol for treatment of COVID-19, which was updated on the 12th of April 2020. Also, the last recommendation, the pharmacists are encouraged to initiate and participate in the building registries and effectively contribute to research and the clinical trials in epidemic and pandemic situation. We saw the name of some pharmacists in the list of Ministry of Health heroes of the researcher, which is good. The conclusion of this is the recommendation, 30 recommendation. I finish from it. Now I will conclude the presentation. The SSCP aim to provide the guidance and recommendation regarding the pharmacist rules and responsibilities based on the existing scientific knowledge during this outbreak. Also highlighted and reinforced the other healthcare provider, the importance of the pharmacist participation and the role in the decision making during these circumstances. We would like to seek the feedback from you regarding the interim recommendation through our official communication channel. And this is official communication channel for the SSCP. Thank you.